I'm Dr. Milind here, and today is one of the special day to talk about the hypertension. And everyone think that what is a hypertension or what is a blood pressure. Now everything pressure is always a complex thing for us. ये pressure क्या होता है? Heart pumps here, but it creates some pressure to go to the brain, to go to the kidney, and to go to your periphery, and that is called as the pressure. The pressure which is created in all your blood vessel is a blood pressure. Now, always you will think that blood pressure is a normal thing. Why we should talk about that? But in certain category, up to a certain level, blood pressure is okay. If it is a 120 by 80, it's too good. But if it's going higher on, if it goes to 140, 150, then what happens to our body? Now, there is a wall in front of me. If I push a water line on that wall with the blood pressure or with the pressure of the water 150, what will happen? Not in a 1 day, not in a 2 day, not in a 3 day, but months together. If I continue pushing a water pressure on that wall, it will have hole throughout. Same thing happens in your body. It will cause damage, and it is called as a target organ damage. That is a problem with the blood pressure. So you need to keep your blood pressure at the best level. And as per the guideline, you cannot treat up to the 140/90. But if you are keeping a 120/70, it is always better for you and for your health. Now, how can I control my blood pressure? Very simple thing. You do a little bit salt restriction before going on the tablet. You do a salt restriction, you do regular exercise, and reduce your weight. What you are at this weight, if you are 80 kg, just come down up to 10% of the weight reduction. Hardly it is 8 kg. So lifestyle modification is very important to control your blood pressure. And once it is not getting control, you have done all these things, till it is not getting under control, then you need to have consult your physician or your doctors. And it is a very simple thing. He will give you some tablets. Now, if you are younger than the 40 years of the age, definitely he will go with the AC or ARB. Or if you are more than the 45 or 50 or 60, something like that, then definitely he will give you calcium channel blockers. But it make a difference? No. आप सुबह नाश्ता करते हो, दोपहर में खाना खाते हो, रात में खाना खाते हो, और पेशेंट साहब आके मुझे बोलते हैं कि डॉक्टर साहब ये गोली खाना थोड़ा डिफिकल्ट है. अरे भाई, दिन भर में तो इतना कुछ तो खा लेता है, कुछ अर्जेंट लगा तो ये भी कुछ खा लेता है. Then what is the problem with a single tablet that you want to take, and that is for your life? Simple thing, take a tablet very regularly. So what should you are applicable? Take that. And now हमारा इंडियन का प्रॉब्लम क्या आ जाता है? When we come to a doctor, we do not come to a doctor for the regular checkup. We come when some problem happens. Remember, medicine is always preventive. कि आपको कुछ होना है, उसके पहले ही हमें उसको रोकना है. If we think that कि हार्ट अटैक इसको हो सकता है, तो we have to restrict that. So that comes to the lifestyle changes. Lifestyle changes क्या है भाई? हो जाता है थोड़ा सा पार्टी हो जाता है, स्मोकिंग हो जाता है, ड्रिंक हो जाता है, लिटिल बिट आई एम ओबेस, आई लाइक टू ईट आउटसाइड फूड, वड़ा भजिया पकोड़ा, ये सब तो मुझे पसंद है. But little bit you have to change that your habits, and you have to come to the green leafy vegetables. You can eat it more, no problem. ये आपके लाइफस्टाइल चेंजेस करने के बाद भी अगर ब्लड प्रेशर हाई रहता है, इट इज द बेस्ट वे टू टेक द टैबलेट। कुछ बुरा नहीं है उसमें, आपको गोली खाना ही चाहिए। यू कैन डू अ सॉल्ट रेस्ट्रिक्शन लिटिल बिट, बट अगर हाइपरटेंशन है, बीपी इज क्रॉसिंग मोर देन 130, 90, then all the guidelines says you should take a blood pressure tablets. Okay, अभी ये हो गई गाइडलाइन की बातें। अभी अपन अगर डिटेल में जाते हैं तो व्हाट आई शुड टेक सर, शुड आई टेक अ डाययूरेटिक, शुड आई टेक अ एसी इनहिबिटर, शुड आई टेक अ कैल्शियम चैनल ब्लॉकर? Then the simple thing is that if you are obese and there is a volume overload, then you should take a diuretic. If I am a diabetic patient, then it is always best way to go for the ARB, that is the angiotensin receptor blocker. Then the ARB are the most helpful drug for you. But if you are a cardiac patient, then always go for the ACE inhibitors like the ramipril, captopril, and these are the good drug to control your blood pressure and find out what is your blood pressure. Until there are the few myths and like that कि सर मेरा घर में बीपी अच्छा रहता है, हॉस्पिटल में आता हूँ ना, आपको दिखता हूँ ना, मेरा बीपी बढ़ जाता है. What is that यार? It is called as the white coat hypertension. What is that? जब भी डॉक्टर को देखते हैं, व्हाइट कोट पहन के देखते हैं, तो उनका बीपी ऐसे ही बढ़ता है. या फिर देयर इज वन अदर थिंग्स लाइक दैट मास्क हाइपरटेंशन. व्हाट इज दैट? वो मास्क हाइपरटेंशन इसलिए कि जब भी घर में जाते हैं उनका बीपी बढ़ा रहता है, हॉस्पिटल में आते हैं तो कम रहता है. व्हाट इज द मास्क हाइपरटेंशन? करेक्ट, उनका बीपी के डर से बीपी बढ़ता होगा. दैट मे बी ट्रू, बट इफ यू फाइंड ऑल दीज थिंग्स, go for the ABPM, that is the ambulatory monitoring of the blood pressure. वो करो, you need that thing. When you suspect कि मुझे blood pressure नहीं है, do ABPM. Find out what happens with your blood pressure in 24 hours. If it is going, you get a graph of near about 24 hours. If it is going higher, always say, then you should take a blood pressure tablet. Now, simple thing is that there is something like a night dipper. रात में आप जब सोते हो तो आपका ब्लड प्रेशर कम होना चाहिए. You should have lesser blood pressure and you should sleep peacefully. But ABPM करने के बाद मालूम पड़ा कि आपका नाइट का ब्लड प्रेशर हाई है. तो why don't you take a tablet? If you are a patient of OSA, obstructive sleep apnea, जहाँ पे मैं सोता तो अच्छा हूँ सर, लेकिन या खर्राटे बहुत मारता हूँ. That खर्राटे create a hypoxia, that create a erythropoietin secretion that stimulate your RAS system and that gives you high blood pressure. So ये तो treat करना ही चाहिए आपने. 95%, 99.5% heart attack comes in the early morning. Even गांव में बोला जाता है ना कि भाई पैरालिसिस हुआ, इसके शरीर पर से हवा गई, ठंडी हवा थी सर, हवा गई and then he got a paralysis. It's not like that. It's a sympathetic stimulation which happens early in the morning, which is disturbing your sleep as well as your blood pressure. And blood pressure is very high, which cannot provide proper blood to your brain. And that causes the ischemia, or that even causes the bleed in your central nervous system. And that causes a lot of problems. So be aware of these things. A blood pressure control is very much needed in the Indian population. If we see in Indian population or even international level, if we got just a check for a figure, if we got a patient of the 4 who got a hypertension, out of 4 hypertensive patients, only the 2 patients are taking proper medication for the blood pressure. Out of that, only 1 is in a very good control and remaining 3 are not controlled. So that much severeness is about this hypertension. You need to control, otherwise you have to face lot of problem with the increase blood pressure level. So coming again to the drugs. So you had a lot of choice. You had ACE inhibitors, you are ARB, you had a beta blockers, you had a calcium channel blockers, you are diuretic. Now beta blockers is gone little bit on the down level. But if you find the Indian person, they had always higher sympathetic activity. Always they are in the trace. Like a Mumbai, like a place, they have to catch the train, they have to catch the local, they have to run for the office, they have to come return back, and they have to face the problems in their family when they come back. Or फिर तो बीवी का है ही. They have to face all these problems. So always their sympathetic activity is very high. So in this patient, newer beta blockers are one of the good drugs to give them, like an nebivolol, celiprolol, carvedilol, or bisoprolol. These are one of the best drugs to give them. But old age patient, now they are coming with the blood pressure and all these things. The calcium channel blocker become the drug of choice in this patient. What are these calcium channel blockers? Your amlodipine, your azilodipine, and newer beridipine, and newer drugs coming up. So these are really good drugs. And where you are volume overload, give a diuretic, no problem. Preferably give with the last electron till it's calm down. His all volume overload come down. Give him diuretic. Once he is dry, then again change to the chlorothalidone, or you change to the hydrochlorothalidone. No problem. So keeping your blood pressure in a control is a very important thing. Now, if we see other things like diabetes, dyslipidemia, all this will come with the blood pressure. How? Yes. In 100 ml of the water, if you added the 200 ml sugar, now the sugar get concentrated. Our water get concentrated. Okay. If this is a concentrated fluid, the blood pressure or the osmolarity pressure of this will be more. And definitely it will cause a blood pressure. So always remember that when it comes to diabetes or when it comes to dyslipidemia, always think of the hypertension and treat according to the patient comorbid condition. If he is a diabetic, then better way to go for the ARBs. So these are the things which are very much needed in the blood pressure control. And what it does, lastly, it causes a target organ damage. What is a TOD, or a target organ damage? Now, always your blood pressure is very high. It is going to your kidneys, it is going to your brain, it is going to your liver. One day, your glomerulus will say that your efferent arteriole has pushing a blood pressure more than the requirement. What will happen? It will cause a glomerular disease. It's called as a hypertensive glomerular disease. And kidney will slowly start getting damaged. Same thing happens with the brain. If it is continue flow to the brain में इतना प्रेशर से अगर कोई ब्लड जा रहा है तो up to a certain limit it can tolerate. After a certain limit, it can cause damage to the vessel. There may be endothelial proliferation and there may be the blocks which can cause ischemia. और ऐसा भी अगर होता है तो they can rupture your blood vessels and they can cause a bleed. फिर आप बोलेंगे brain hemorrhage. In simple thing, तो गांव का आदमी मिलता है तो वो बोलता है सर जस्ट ब्लड प्रेशर है कुछ नहीं है. When we check his blood pressure, we found out 160 by 100. Now These are the problems. Sir, blood pressure है. Sir, क्या गोली लेने की जरूरत है क्या? So we need to explain this patient कि बाबा आज नहीं होगा, कल नहीं होगा, but years together this blood pressure will cause damage to you and damage to your vital organs. So we should really care about these patients who are. And then these are the essential hypertension. Now some patients come younger age, 20 years, 25 years, 30 years, come with the accelerated hypertension. First episode, sir ऐसा हुआ and my blood pressure is so high. सर मम्मी से झगड़ा हुआ, बीवी से झगड़ा हुआ, वो तो हर वक्त की बात है. झगड़ा हुआ और मेरा बीपी इतना शूट अप हुआ. Don't think it is essential hypertension. You have to find out causes for the secondary hypertension. And what is the secondary hypertension? It can be renal artery stenosis. It can be a coarctation of aorta. It can be huge dyslipidemia. It can be a family history, or it can be something like a Addison's disease, like a cons. So always you have to think who is your patient, what is his age, how come he with the severe blood pressure, at what age, and definitely according to that you have to think for that. What I am facing the patient and how I should treat. So there are a lot of things about the blood pressure, but when you are increase the blood pressure more than the 140 by 90, it is essential for you to take the treatment, take the tablet, consult the physician and take the tablet. And I don't find anything goes wrong if you are taking a single tablet. डॉक्टर साहब मुझे आदत लग जाएंगी, डॉक्टर साहब मुझे गोलियां खाना नहीं है. Says just take the tablet, control your blood pressure first, then we can reduce the dose. If you are giving amlodipine 5, yes, I will reduce the dose to the half. Okay, if it is controlled for the months together, minimum 3 months together. If it is still controlled, it come down to 1/4 of the tablet. But treating a patient with the blood pressure is very essential. It is one of the comorbidity, or it is causing the most damage to you and your heart. Now, if you are seeing a complication of a hypertension, dilated cardiomyopathy, or a renal failure, most common causes. IC bleeds and will happen if it is a high systolic blood pressure. But getting a cardiac problem or getting a LVH, left ventricular hypertrophy, or cardiac failure without preserve or with reduced ejection fraction or preserved ejection fraction. But hypertension can cause both of these things. It can damage your heart like anything. So if pumping it reduce, then you will even feel the breathlessness when you are even walking, when you are taking rest. If it is renal, that can land into the end stage renal disease. Maybe hypertension come after diabetes, but definitely hypertension has a very good role to cause end stage renal disease. So if you want to save your organs from this all complication, hypertension need to be treated as early as possible, because the problem do not come in a day or months together. It comes later on. Treating a patient of hypertension, it will save his life. But if you don't treat nowadays, what I say is I am pulling a water on a wall, it can make a hole through and through. Same thing happens in our body. The blood pressure, which is continuously high, it can cause any damage in your body, including your brain stroke hemorrhage, renal failure, cardiac failure. And now the simple way to observe this thing is the regular checkup of the blood pressure. All the patient will forget. I had that time मेरा fight हुआ था घर में ऐसा होता and then मेरा BP बढ़ गया. It is not. Check your do ambulatory blood pressure monitoring. Check your BP regularly, and then find out when you are dipping or non-dipping. Blood pressure कम होता है कि नहीं कम होता है. अगर नहीं कम होता है तो you need to treat it. Again, second myth about the hypertension or blood pressure is that, सर ऐसे बीपी है, हमारा फैमिली हिस्ट्री है. मेरे फैमिली हिस्ट्री में ना क्या है कि बाइकस्पिड एओर्टिक वॉल है, तो सबका बीपी ऐसे हाई रहता है. Does it mean? No, not at all. You have to treat to find out the other causes why you are getting such a high blood pressure. Treat early, treat in the time, will help your patient and will help all the community. And in India, what is the most problematic thing is that we are very negligent about the blood pressure. सर उम्र हो गई तो बीपी तो बढ़ना है. ट्रू, मानते हैं, लेकिन उसको एक लिमिट पे आपको कंट्रोल भी करना है. There are certain guidelines कि you don't control the BP. Very old things like when the Kennedy had something like a blood pressure of 170 and 100, he don't used to treat US president. But that is an old thing. New guidelines says you clear cut that treat the blood pressure. And keep it lower than the 140 by the 99. And simple reference goes with your lifestyle modification, your salt restriction, your regular exercise, avoid a sedentary lifestyle, yoga, and keeping your mind very peaceful. That don't give any aggressive reaction to anywhere. What is that? Aggressive reaction. यहाँ पे कुछ स्नैक भी पड़ा हुआ ना, तो एक आदमी है जो जगह पे ही घबरा जाएगा या चड्डी में सुसु कर देगा. He will frighten that much. एक आदमी है जो उठ के चला जाएगा, भाई स्नैक तो नॉन पॉइजनस है, मैं चला जाऊंगा. तीसरा आदमी है जो स्नैक को उठा के घर के बाहर फेंक देगा. So what the reaction you gives to the situation, that will increase your sympathetic activity. That sympathetic activity will always create an increase in your blood pressure, increase in heart rate. So all listener, this is a very simple thing. Blood pressure is one of the killing, or it is called a silent killer. No one will come to know कि I had a blood pressure till you are not measure. आप कभी डॉक्टर को जाके नहीं दिखाए तो आपको ब्लड प्रेशर मालूम नहीं पड़ेगा. So blood pressure is a silent killer. It will take out your good time. It will take out the, what we call as the quality of the life. It will take you to the morbidity and mortality. A paralysis, a heart attack, may you are survive, but it will cause you the weakness. You will not able to walk, you will feel breathlessness due to the cardiac failure or due to the paralysis. Your legs will not allow you to walk. Okay. So it is a silent killer. And we know that if we had a good opportunity to treat it, हमारे पास अगर कुछ है कि हम ये चीजों को कंट्रोल कर सकते हैं तो करना चाहिए ना भाई. It is needed. You should control your lifestyle. You should control your salt intake, oil, fatty, तला हुआ सिर्फ जुबान को अच्छा लगता है, शरीर तो नहीं बोलता है भाई. So you have to be in very good control of these things, and then you can control your blood pressures. So what we do, all the physicians on the World Hypertension Day, we try to tell our patients, our colleagues, our community, the blood pressure is a not simple thing. Don't take it simply. Okay. It is something which can cause very, very bad influence on your body, can be do little bit harm or more harm to your body. With that, I would like to take your willing to say goodbye. Okay. But don't take blood pressure as a just it comes and will go. Don't go. It remains once you cross the age of the 50 years. Okay. Thank you.